How's Jack doing today?
Well, he had a fever this morning, so I don't think he's going to go home.
Okay. Good morning.
Hello.
Do you have Jack today?
I do. Okay. Jack did spike a temp this morning of 38.7 rectally, so I gave him some Tylenol about 30 minutes ago. He seems more comfortable now, and I'll go check with the family to see if you guys can round him right now.
Sounds good.
Good morning.
Hello.
Good morning.
Hi. The team is ready to round, like we discussed this morning. Is it a good time?
Absolutely.
Sure.
Okay, I'll go get them. All right, they said it's fine.
Good. Good morning.
Hi, good morning. Good morning.
Morning. Hello.
If you remember, this is Dr. McGee from yesterday. He's our pediatric attending.
Yes.
And this is the rest of our pediatric team. So we've discussed Jack this morning, who is 4 weeks old and here for suspected sepsis. This is hospital day 2, and as I'm sure you've noticed, we've taken him out of isolation because his cultures have been negative for 24 hours. So that's great news. Jen, would you like to start, please?
Jack seems more comfortable since we gave him Tylenol this morning. He's feeding pretty good now. I don't have any other safety concerns. Do you guys have other concerns?
No.
I think he's doing a lot better today. He's eating better. I think it's just the fever he had this morning, but no, everything's much better.
Okay.
So Jack hasn't had any problems with his breathing. His heart rate has remained stable. He gets a little bit fussy when he spikes a fever, but he seems to calm down well with Tylenol, which we saw this morning. He's feeding a lot better today, and he's making good wet diapers. We're continuing to watch his blood cultures, urine cultures, and spinal fluid cultures, which is from the spinal tap we did in his back yesterday. So far on cultures, we're not seeing anything. So if everything continues to look good, he'll be done with antibiotics tonight at 8 p.m. So our goals for Jack will be for him to continue to eat well, for him to remain without a fever, and for all of his cultures to remain negative. So we can reevaluate him this evening and hopefully plan for a discharge in the morning.
Wow, that's great.
We also started Jack on vitamin D, which helps with his bone growth, and that's something we'll want you to continue at home as well.
Will we get a prescription for that before we leave?
Yes, that's something we'll send you home with.
Okay.
Mom and Dad, do you have any questions or concerns?
I guess I just wonder why he got this fever, why he got so sick, if you know what's going on.
Well, whenever a baby this age gets a fever, we have to think about whether it might be either a bacterial or a viral infection. That's why we did the cultures in the spinal fluid and in the blood and in the urine. And so far, nothing is growing out of any of them. If nothing is growing out after 48 hours, then we can assume this was all caused by a virus, and then we can send you on your way.
Now, we also have a 2-year-old at home. Is Jack contagious right now? And how did he get this in the first place?
Well, the virus can be spread through the air. It can also be spread on your hands by touching contaminated surfaces. So just use really good hand hygiene when you're at home, and that will help reduce the chances that anybody else will catch this.
That makes sense.
Do you guys have any other questions?
No, I don't think so.
No.
Thank you guys so much for everything.
Well, we'll be back to check in on you this afternoon, and if any questions come up, we'd be happy to answer them.
Great.
Okay?
Thank
Thank you.
Okay, thank you.
Great.
Thanks, everybody. That's good news.
Okay, so maybe tomorrow morning?
Yeah.
I do have to finish rounding in my other patients right now, but I'll be back in about an hour. We'll go over discharge goals, and we'll also go over any other questions or concerns that you may have, okay? Feel free to write them down so you don't forget, okay?
Okay, thank
All
you
right.
so
Thank you
much.
very much.
You're welcome.
That's good.
Thanks, Jen. What else do you have?
I have Grace next door.
Okay, let's go see Grace.